Hi, I'm Dr. Dabbs. Today we're going to talk about chiropractic and what is chiropractic and what can you expect from chiropractic care. Chiropractors are basically have a 5-year degree doctorate from chiropractic college, kind of like how a dentist has a degree and a medical doctor has a degree from the colleges. We have 5 years. And in those 5 years, we learn all about the biomechanics of the body, the nutrition, movement, the physiology, the physical therapy part, a lot of different topics, anatomy, you name it. It's pretty similar to med school. So we're using mostly our hands to fix them. And we use other things like exercises, which we have a lot of exercises in our suite here. We use muscle stim and heat and all these other therapies we have in our office here. But the hands do the magic basically because we can palpate and feel everything. We're best known for treating spines, right? So the lower back. And you know, a lot of doctors want to rely on x-rays and MRIs, and we rely on those too. But we can feel things going on in here. And we can feel if a joint's moving properly or if it's stuck. And if it's stuck, it may look like this, arthritic. So you have a normal one right here, which kind of glides. And then you have one here that just doesn't move. It's like a rusty hinge. So we can palpate these and do some ranges of motion, muscle testing, all kinds of different formal tests to determine. But we can actually feel what's going on in there and see that, oh, that joint is just not moving. And then a healthy person, yeah, it's moving just fine. Then we go in there and we will manipulate the joint very gently. We'll just go click and it'll start to move again. And you people hear a click. That click is nitrogen gas and fluid going into the joints. It's like oiling the joint. Now it's moving. Since it's moving, it's gonna rebuild the cartilage again. So the cartilage in the joints, in the facet joints here and the main joint, will start to rebuild. Sometimes they stick back up, so you have to have it done repetitively over anywhere from 30 to 90 days, sometimes even 6 months. But most likely in a 2-month period, they're moving a whole lot better and they're getting out of pain, if not completely out of pain. And this could be a pretty degenerative arthritis that we're trying to fix, and it will come along. If it doesn't, there's of course surgery, but I rarely see a patient go to surgery. We're also known for treating disc bulges in the back. So here is a normal lower back. So if I pull this out of my lower back, that's what it would look like. A nice disc in here, a vertebra and nerves coming out of the spinal cord. What happens is, if you're bending over and you pick something up and you do it in the incorrect maneuver, you'll blow that disc out like that. And that disc is now pinching this nerve. That nerve is going to fire down your leg. It's going to go to the muscles, it can go to your organs and go a lot of places. So our job is to get that disc to suck back in place. And we do that with adjustments, decompression therapy where it's squeezed together like this and it's just not good. We pull the vertebra apart gently on a decompression table and it sucks it back in. So there's a lot of different ways. And then we do exercises to rebuild the area so it doesn't happen again. So that gives you another example of the kinds of things we treat. But it's not just spine. It could be a knee. If the knee has some arthritis in there and doesn't move properly, we adjust the knee. And then the cartilage just grows back because it's movement that creates cartilage movement. If you don't have any movement or you're not moving much, you're going to degrade the joints and the muscles. In fact, if you put a cast on your leg, in 2 days, that leg's going to be half the size of the other leg, and the neurology is not going to connect very well, because I know, because that happened to me when I was 20 years old. So movement keeps you alive, it keeps your body functioning, it keeps you healthy, and that's what chiropractors do best, is get you moving again and get you healthy through exercises, muscle stim, traction, decompression, all kinds of physical therapy. And the best thing we do is nutrition and adjustments and manual care. So come to the chiropractor because he's going to make you feel good. There's nothing else like it. If you have any questions, please don't hesitate to comment below and look at our website and call us if you want to become a patient.